Most women know that as they age, their fertility chances decline. But to what extent? And what measures can women take to be proactive about their fertility? Advances in technology and treatment are, of course, helping many couples add to their families, even those who previously had thought they really didn't have a chance. So today, we have fertility specialist Dr. Ryan Riggs from Research and Menorah Medical Centers here with talk about what you can do if you're having some difficulty becoming pregnant and how the hot trend of egg banking could play a role in your future of starting a family. So thank you for joining us.
Thank you for having me.
It is a hot topic, that is for sure. Is it an increasingly hot topic or an increasing problem?
Well, egg freezing has been around for several years, and I just think that it's become more well-known and more available to patients over time.
And how do we know, though, if we even need to go there and talk about egg banking? How do we know we're really having a fertility problem?
That's such a good question. So in the medical world, we think of infertility as trying to conceive for 12 months if you're under 35 or 6 months if you're over 35. But if we're talking about egg freezing, we like to freeze eggs as early as possible, preferably by the time women are in their late 20s.
Can we talk about that process and how, invasive it is? It sounds like a big project.
It's a little bit of a big project, and it does take some time and planning. All total, the egg freezing process would take about 6 weeks from beginning to end.
Okay, and that involves what?
So usually some control of the menstrual cycle using birth control pills, and then about 8 to 10 days of injectable medications to stimulate the ovaries. That way we get as many eggs as we safely can, and then a short procedure to harvest or retrieve the eggs, and then the eggs are then frozen. And the most important thing to understand about egg freezing is it's basically a way to beat the biological clock, because the eggs don't age and embryos don't age once they're frozen.
Right. So if you're planning to delay the start of your family, that may be an option for you.
Yes, it's very important. And the earlier we can freeze the eggs, the greater the chances of success.
Okay, I see. And so who should really look into this process?
Well, I think anyone who is going to delay childbearing, for example, to pursue additional training or education, or may just not have met Mr. Right, should look into being proactive and consider freezing their eggs as early as possible.
It's such an interesting topic, isn't it? But it's something that you should consider if indeed the clock is against you, is working against you. That is for sure. Dr. Riggs, thank you so much for shedding some light on that. It is a really interesting topic. For more from HCA Midwest Health, you can always go to KCTV5.com and click on the Health tab.